I'm Linda May with Preferred Benefits. I also have Joe Prescott with me. He will be going over the steps for updating your enrollment elections in Employee Navigator. We're going to talk about who is eligible, when to make changes, contacts, medical, dental, and vision benefits, flexible spending accounts, your disability and life insurance benefits, how to make your open enrollment elections on Employee Navigator, and lastly, a few things to think about. Starting December 1st through 15th is your open enrollment period. So as long as you are a full-time employee employed for at least 30 days, you're eligible to enroll at this time. If you want to cover your spouse, you'll need to get a letter from your spouse's employer confirming whether or not your spouse is eligible for benefits through their own employer. The letter must be submitted to your manager by December 31st of this year, or the spouse will not be covered as of January 1st, 2019. Dependent children can be covered up to age 26 on the medical plan and up to age 19 or 23 if they're a full-time student for dental and vision. All employees must elect their benefits for 2019 Employee Navigator from December 1st through December 15th. After that, you would need a qualifying event to make an enrollment change during the year. Qualifying events are things like marriage, divorce, birth, or death. Besides going directly to Aetna or Cigna, you can always contact Preferred Benefits for help with benefit questions or concerns. I'm your primary contact, but if I'm out of the office, you'll be able to reach Jody. Joe can be reached for questions concerning Employee Navigator. Contact information can be found on your member ID card, but it is important for you to register at Aetna.com for your personalized website where you can access all of your claim information and find network providers. If you register and log in at Aetna.com to search for providers, it will take you directly to the provider network that applies to your plan. If you don't register and log in, when you go to Aetna.com, you will have to choose the correct network, which is much more difficult because there are many to choose from. We also recommend registering at mycigna.com to access your dental and vision, claim, benefit, and provider information. Contact information is also available on Employee Navigator. As you've heard from John Parcio Jr., 2018 was a very costly year for the medical plan, which is resulting in the need to update the plan deductibles, copays, and maximums to levels that are closer to the industry norm. Even with these changes, your medical plan is still richer than most. And the good news is that your contributions for the medical plan are not changing. The medical plan is with Aetna and utilizes their Choice point-of-service network. Remember that using network physicians and facilities will keep your costs lower. Utilizing virtual visits with Teladoc or convenience care clinics will also help keep costs down. Your deductible for 2019 in-network is $500 for single, limited to $1,000 for the family. Your out-of-pocket maximum in-network will be $3,000 single, limited to $6,000 on the family. Preventive care and routine physicals will continue to be covered at 100%. Office visits to your primary care physician will have a $20 copay, and specialist visits will have a $30 copay. Urgent care has a $35 copay, and emergency room visits will have a $300 copay, and then the plan will pay 80%, and you'll pay 20% of the remaining balance. Inpatient and outpatient facility and hospital services are covered at 80% after the deductible, and you'll pay 20%. And prescription drug copays are $10, $35, or $60 at the pharmacy, or you can get a 90-day supply for $25, $87.50, or $150 through the mail order program. Specialty medications. For preferred specialty medications, you'll pay 25% up to a $250 maximum, or for non-preferred specialty medications, you'll pay 25% up to $500. Out of network, you'll see that the deductible is $10,000 for single, limited to $20,000 on the family, and the out-of-pocket maximum is $30,000, limited to $60,000 on the family. Out of network is where the major changes are being made. After you've met your deductible, out of network, the plan pays at 50%. until you've reached that out-of-pocket maximum. The emergency room would be covered at the in-network level with a $300 copay, and then you'll pay 20% of the remaining balance. Remember to request generic medications, or you'll have to pay the difference between the generic and the brand price. Aetna is also moving to a new standard formulary for 2019, so you may experience a few changes. Out of over 300 employees on the plan, with more than 600 total people covered, Aetna found only 26 members who would be impacted by the formulary changes. If you were one of those 26, you'll receive a letter from Aetna with information about the changes and how it impacts you. They will suggest other medications you may want to consider to keep your costs down. The prescription drug formulary changes are not all negative changes, however. Some of you will see lower copays than you're currently paying. Your dental coverage remains with Cigna with no change in benefits or cost. In-network preventive services are covered in full with no deductible. Basic services are at 90%, you'll pay 10%, and major services are at 60% with you paying 40%. There is a $50 single deductible that's limited to $150 for the whole family. That applies to basic and major services only. Your annual maximum is $1,500 per person per calendar year. Orthodontia is included for children up to age 19 at a 50% benefit up to $1,500 per lifetime. Out-of-network pays at lower levels, plus you can be balance billed for amounts over the usual and customary amounts, so use in-network providers for the best benefit. Your vision coverage remains with Cigna with no change in benefits, but with a very small increase in cost. In-network, your eye exam is covered every 12 months with a $20 copay. There is also a $20 copay for lenses every 12 months. Frames are covered every 24 months with a $120 allowance, and contact lenses also have a $120 allowance. More plan details and the updated rates can be found on Employee Navigator. Again, you'll always get your best benefit by using in-network providers. A healthcare flexible spending account allows you to put money aside on a pre-tax basis to use during the year when you need it for eligible expenses that include your copays, coinsurance or deductibles under the medical plan, prescription drug costs not covered by the medical plan, and dental and vision not covered by your insurance plans. In 2019, you can elect up to $2,700 on a pre-tax basis. The funds can be used for your own eligible expenses or for your spouse and any tax dependents, whether you cover them on the plan or not. You'll get a prepaid benefits card to make accessing the funds easy. The benefits of a healthcare flexible spending account are 1, the tax savings, and 2, the money is available when you need it. Here's an example. You decide, based on your out-of-pocket expenses from 2018, to elect $1,000 for your health care FSA. If you're paid weekly, you would have $19.23 deducted each week from your paycheck beginning in January for 52 weeks. Here's the benefit. The full $1,000 is available to you on January 1st or whenever you need it during the year for eligible expenses. The limitation of an FSA is that the funds must be used in 2019. You'll have until March 31st of 2020 to submit claims, but the expenses have to have been incurred in 2019 or you will lose any money remaining in the account. Also, please be aware that if you participated in the flexible spending account in 2018, that you must use any funds remaining by the end of this year. You'll have until March 31st to submit claims, but the expenses must be incurred by December 31st. You can also set aside money on a pre-tax basis for dependent care for children up to age 13 or for adult care for family members who are unable to care for themselves. In 2019, you can contribute up to $5,000 for dependent care expenses, and like the healthcare FSA, funds must be used by December 31st. You'll have until March 31st, 2020 to submit those claims. The benefits, again, are the tax savings, and the limitations for dependent care account flexible spending account is that the funds cannot be used until they've been deducted from your paycheck. And if you don't use those funds in 2019, you will lose any money remaining in the account. Again, please be aware that if you participated in the flexible spending account in 2018, you must use any funds remaining by the end of this year. You'll have until March 31st to submit claims, but the expenses must be incurred by December 31st of this year. Last year, we offered voluntary short-term disability with Lincoln Financial. We're moving that benefit to Cigna, who has the voluntary long-term disability coverage. Cigna will take over the existing benefits at slightly lower costs. The benefit of moving the short-term disability benefit to Cigna is that if you become disabled for longer than 13 weeks, the transition from short-term to long-term disability coverage is much easier with the same insurance company. Plus, the rates are a little lower. If you do not currently have short-term or long-term disability coverage and want it now, you will need to complete an evidence of insurability form. You'll find all of this information on Employee Navigator. Short-term disability benefits begin on the 15th day that you're unable to work and will pay 60% of your weekly earnings up to $1,000 per week for up to 11 weeks. If you remain disabled after those first 90 days, the long-term disability plan will begin to pay 60% of your earnings up to $6,000 per month and will pay up to your normal Social Security retirement age if you remain disabled. Your life and accidental death and dismemberment benefit provided by Multiplastic remains the same as it is currently with Cigna. Just remember to update your beneficiary when you complete your open enrollment elections in Employee Navigator. For the voluntary term life and accidental death and dismemberment, Cigna is offering an open enrollment for 2019. This means that right now you can get up to the guaranteed issue amount of $200,000 without answering any medical questions. You can get up to $25,000 for your spouse without answering medical questions, and you can get up to $10,000 for your eligible children. So you can keep what you have, increase what you have up to the guaranteed issue amounts, or if you don't currently have coverage, you can enroll now up to the guaranteed issue amount without medical questions. All of this can be found on Employee Navigator, including the cost for this coverage.
Just like last year, you'll be completing your open enrollment on Employee Navigator. So Employee Navigator, to log on, current users or new users, go to employeenavigator.com and click Login. Returning users, log in with the username and password you selected. If you have forgotten your password, please click the Reset Forgot Password link. First-time users, click on the Register as New User, create an account, and create your own username and password. Step 2, after you log in, you'll be directed to your welcome screen. From here, click Let's Begin to complete your required tasks and enrollments. Step 3, start your enrollments. After clicking Start Enrollment, you'll need to complete some personal and dependent information before moving to your benefit elections. Your current information will be listed, but please make sure to review and make any updates as necessary. Please also have dependent details handy. To enroll a dependent in coverage, you will need their date of birth and Social Security number. Step 4, benefit elections. To enroll the dependents in a benefit, click on the checkbox next to the dependent's name under Who I Am Enrolling. Below your dependent, you can view your available plans and the cost per pay. Select a benefit, click Select Plan underneath the plan costs. To elect a benefit, please click Select Plan underneath the plan costs as well. Click Save and Continue at the bottom of your screen to save your elections. If you do not want a benefit, please click Do Not Want This Benefit at the bottom of the screen and select a reason from the drop-down menu. Step 5, Forms. If you have elected benefits that require beneficiary designation, basic life or voluntary life, for example, or completion of an evidence of insurability form, you'll be prompted to do so after the benefit. Step 6, review and confirm elections. Review the benefits you have selected on the enrollment summary page to make sure they are correct. Then click Sign and Agree to complete your enrollment. You can either print a summary of your elections for your records or log in at any point during the year to review your summary online. Step 7, Review and confirm elections. To complete any required tasks, please click Start Task. If your HR department has not assigned any tasks, you are finished.
Important things to think about. Use network providers. The negotiated costs are much more favorable to you and to the plan, and there are programs in place to be sure that you get the best care. Be sure to ask for generic medications. Discuss your care with your physician. Ask questions. How much will my treatment cost? Can I be treated another less costly way? When you register at Aetna.com, be sure to take advantage of their cost estimating tool. Review your bills and explanation of benefits. Everyone makes mistakes. Be sure to ask questions. Use convenience clinics or Teladoc for minor medical conditions. If you've never used Teladoc before, Multiplastics will reimburse your $20 copay when you or a covered family member uses Teladoc for the first time. And remember, everyone, all employees must go to employeenavigator.com starting December 1st through December 15th to make your open enrollment elections. Thank you.